My academic background is that I started my master's degree at the University of Jyväskylä, and I finalized with molecular cell biology. After that, I started my research career and did my PhD here at the local university hospital. And after finishing that, I moved to the Department of Pathology and started my specialization for clinical cell biology. And that's a kind of a unique profession here in Finland, or unique training program here in Finland. And it produces specialists for the work of kind of lab managerial work for the pathology labs. During the specialization, you get kind of on-site training on all of the aspects that you need as a clinical cell biologist. And these include the whole process of pathology lab, the legislation that is involved in clinical lab work, and also all kinds of things, including budgeting, new test methods, how to implement them, and so on. Well, I have to say that I don't have a typical work day. There are some things that I do almost every day, but usually, even if I plan my day beforehand, when I come to work in the morning, there's always something that changes the whole plan. So my day usually starts by reviewing the immunohistochemical slides that I get from the overnight runs. I review their technical quality and also do pre-screening for breast cancer slides before they are delivered to pathologist. Then I go through the emails as everybody else does also. And after that, I will continue whatever task is at hand. It varies from day to day, so that I usually do new assay optimizations, problem solving, and all the things that happen and emerge from the daily practice of the lab. The collaboration between all of the professions in the lab and also elsewhere in the hospital, that's a crucial thing to get things done and to get things done efficiently and with the required quality. Of course, we have meetings in the lab. We have staff meetings. We have team meetings for instance for histology staff, for immunohistochemistry staff, for cytology staff, and so on. Nothing works perfectly in the lab if there's no connection between all of the professions. So we need the constant discussion of each and individual samples, how we are going to treat them, what kind of assays we need from those. And I mean, the lab also needs constant feedback from the pathologist, because they are the last persons to review the stainings, for example, that the lab performs, and they have to get the final feedback of the quality, for instance, of the histological stains, so that we can detect early the possible problems that arise and try to make corrections. So the connections inside the lab is crucial, but also the discussion between pathology lab and the clinicians and all the other parties also outside the hospital. That's something that is crucially needed to get things done. The guidelines are cornerstone in all of the diagnostic work, not only breast cancer, but for everything else. So we have to and must follow all the international guidelines, including WHO and, for instance, ASCO for breast pathology. And those guidelines are needed so that the diagnostic work follows the scientific results that have been obtained, for instance, for breast cancer. If we don't follow them, then the whole thing goes haywire, and I believe that also the treatment results for the patients wouldn't be as good as they are now. In my field, the breast cancer diagnostics in pathology lab, I kind of think about as a chain of events, starting from when the sample arrives to the lab and when pathologists give the final report on the sample. My responsibility in that process is that I try to keep the standard quality at the required level in all of the steps that the sample takes in the lab, starting from when it's arrived, when it's dissected, when it's processed, embedded, sectioned, and finally stained. If one of the steps in the process doesn't go as intended, then the end results, for instance, marker staining or HER2 or ER or PR stainings, they can give wrong or erroneous results, and that can cause effects for the patient. Quality control is the most important thing that, or one of the most important things that any kind of clinical lab has to do. So using your own internal quality controls, follow-upping the controls yearly basis, and also participating in external quality rounds. That's the only thing that we can do to make and try to maintain the high quality that is required for patient samples. So any kind of lab is not an island that works in its own kind of a vacuum. You have to have a external comparison how you are performing, and quality control rounds and the internal work, it's must that you have to have. I think that this kind of individual treatments and especially in cancer, it's increasing and kind of developing all the time. And we have seen in many cancer types that new targeted therapies are coming, new assays in pathology lab and elsewhere are coming that are used to determine which of the patients are most suitable for the new treatments. We haven't seen that so much yet in regarding breast cancer, but I believe that they are coming. And if we think about the kind of standard assays that we are doing, ER, PR, Ki67, HER2, those are also assays that are directing how the patients are treated when they get the treatment for breast cancer. But I think that it will come also to breast cancer and even more in the future. Well, I think that the future of clinical pathology is still bright. We need clinical pathology for the treatment of the patients. There's still quite a lot of development and will be even more in the future regarding what kind of work we are doing. AI will come more strongly to the analysis of histological samples. We are currently digitalizing quite a lot of our samples. Pathologists are viewing them with their computers, and also molecular pathology will increase in number in the coming years. And that entails that we have to implement new techniques. The staff, technicians have to learn new things in their work. And I think that will make or keep the pathology business, clinical pathology, very interesting. And I really strongly urge that young people will take an interest in clinical pathology and, if possible, start to study it and become new professionals for the clinical work.